everyone, and welcome back to my podcast, or welcome to my podcast. If you've never been here before, I hope you stick around. Tonight, we are discussing the really great, note the sarcasm, healthcare system here in Canada. So, if you really want to learn more, stick around. From Cape Breton, it's Saturday night. So, the healthcare system in Canada is pretty good. I say that a little hesitantly because if you're from south of the border, from the US, then you've probably heard great things about our free healthcare system and think we have it so well up here. I hate to break it to you, it's not always rainbows and lollipops here in Canada. Why do I say that? Well, we have a doctor shortage, for one. The wait times are horrific, for two. And then the quality of care, depending on where you are, may be a little subpar. Why do you think I chose to focus on this topic this week? Well, I'll tell you. This week, an immediate family member had an illness and had to see a doctor. This family member does not have a family doctor, which in Nova Scotia, that is the same for over 130,000 people. That's quite a lot. That's about 13% of our population. The province of Nova Scotia only has 1 million people, so 130,000 to be without a doctor is very significant. I'm lucky I have a family doctor. However, this family member does not, and they also have some major illnesses. So, not having a family doctor is quite concerning. However, that was not the cause of my thoughts on the healthcare system this week. So, I'll give you a little background. The healthcare system in Canada is fairly good. We pay a lot in taxes to have a quote-unquote free healthcare system. Yet, it's not truly free if you think about it, because our taxes are quite high. In Nova Scotia, and each province does regulate the healthcare system per province, so it is a provincial-run program. So in Nova Scotia, we have what's called an MSI card. And this card has your healthcare number on it, as well as your name, date of birth, and the expiry date of the card. This is a blue card. It's actually quite pretty. But this is what you present at your doctor's office or at the hospital when you need to see a doctor. It's usually what is able to get you the free side of the healthcare. So again, we pay a lot in taxes, so it's not technically free. We pay it out of our paychecks, and when we pay property tax and government tax and so on and so forth, all of that goes into a bundle of money that the province then distributes for different things, including healthcare. So we're not paying out of pocket at the time of seeing a doctor, unless your health card is expired. That's a little caveat. If your health card's expired and you haven't renewed it, you might have to pay for your visit right then and there and then be reimbursed that money. So that's a little annoying. Most places, though, will allow you to fill out a form for renewal, fax it out for you, and allow you the service for free. So it's only a little hiccup and a little annoying if you have to pay out of pocket, because it does not happen that often. That brings me to this week's visit. My immediate family member, who was feeling quite unwell, I wouldn't say that this person was dire or, in need of 911 services. However, they were not feeling right. And given past ailments and past conditions, it was just the time to see an actual doctor. It had been going on for about a month and progressively getting worse. So, this family member tried to call what's called here a primary care clinic. in order to see a family doctor without having a doctor. And they got through to the primary care clinic in our local community. However, the next available appointment was not until August 2023. That's months down the road. And if you're not feeling good now, what good is that to you? So, of course, the advice given to this family member was to call an urgent care clinic instead of a primary care clinic. So, on the phone for days, trying to get through to one of the urgent care clinics that was approximately 45 minutes away from our home community. Could not get through, so called one that was about an hour and 15 minutes away, got through to a nurse, discussed the issue. They talked to a doctor and said, our facility would not be able to assist you because it sounds like, based on your symptoms, you need further care. Okay, so calling that other urgent clinic yet again, just by miracle, got through. And I say just by miracle because this urgent care clinic has been full to capacity for weeks now. So the only other alternative besides going to an urgent care clinic or a primary care clinic is to go to your local emergency room. The downside of that is that the wait time at a local emergency room, especially at our main hospital here in Cape Breton, would be minimum 12-hour wait. And if you're an elder person or anybody really, and you're ill or in pain, sitting in a waiting room for 8, 12, 16 hours, the average is 12 hours, seems quite daunting. So of course this family member did not want to have to do that. So when they got through to the urgent care clinic, which again, this certain clinic was about 45-minute drive from our local community, they spoke with a nurse who compared notes with the doctor on duty, and that doctor agreed, yes, I need to see you. So within an hour and a half, we had gone to that clinic. Luckily, got seen by a doctor, a good doctor, by the way, one I had seen in previous circumstances, and that's one thing I had mentioned at the beginning. Sometimes, even if you get to see a doctor, sometimes the care is not really great. But this doctor is really good. And so I was pleased to see that he was the one on duty. The family member got seen, got an x-ray, got blood work, and then the doctor said, okay, you need to go to the main hospital tomorrow morning at 9 a.m. I've called over, I've faxed the order to them. You're going to have an ultrasound, and then you need to go to the emergency room, go to triage, register, and then wait to see the doctor for the results of your ultrasound. Again, this is because this person does not have a family doctor. So it goes back to that being the main issue. So the next day, we go to the main hospital, we get the ultrasound, then we go to the emergency room, triage and register. And then over 8 hours later, which is on the lower end of the wait time, I understand, this person, just ready to be at the end of their rope waiting, decides, okay, in 20 minutes, if I don't get called in 20 minutes, I'm out of here. I don't care what the results are. And that's a sad reality. Luckily, we had been called before that time, and this person is now admitted into the hospital and requires surgery. So it was pretty serious condition. But many people up and leave. During our 8-hour wait at this local hospital, I watched many people, even a woman brought in by an ambulance and waited alongside paramedics until she could be triaged and registered. She waited for hours sitting in a wheelchair and then got up and left because she was tired of waiting. And it's not a rare occurrence for somebody to just get up and leave because they're tired of waiting. It's so excruciating, the wait times, without having any reasonable solution to this. There have been recently people dying in waiting rooms or leaving, going home only to die. People getting in to see a doctor after hours upon hours waiting just to get back to see a doctor and get diagnosed or get testing, only to be told, sorry, it's too late. Your loved one is dying. Would that have been the case if they had been seen immediately? We don't know. And that's the real scary part. We don't know. And it makes me a little frustrated. No, it makes me a lot frustrated, as it does pretty much every Nova Scotian. And then you think of all the other provinces having issues as well. We're not the only ones. I mean, we feel it here because we're local. This is our community. We want doctors. We want more nurses. We want more funding. And this is not me crying out for somebody to reach out and give us that. This is a frustration being vented because our government has just started to say that they're going to start to fix the problem. This is not an acute need that just happened overnight. This crisis in our healthcare system has been building for years, and I would not be amiss to say it's been building for decades. Our government needs to do better. Our government needs to do better for its people. And it would be different if our people here in Nova Scotia had good, deep pockets of money, because then we could afford private care. Because those of you out there listening may not know, private care is available here. But if you don't have deep pockets or you don't have private insurance that would cover stuff like that, for diagnostics, for specialty doctor care, then you're going to wait. And if your wait time is excruciating, like ER wait time averaging 12 hours, that may seem like a short amount of time. It's only half a day's wait. But when I tell you that people are dying of cancer because they can't get a diagnosis for 6 months to a year and then start treatment, what does that say? That says that there's a deeper problem. And I don't know the answers to how to fix it. I'm not in that capacity. But I desperately plead to those that are in that capacity, that do have the answers or can come up with the answers, to please start and get something going. Because the workers in our healthcare system, the doctors, the nurses, the RNs, the LPNs, the regular workers, even the custodians that are cleaning up the hospitals and the offices, they're overworked. They are so overworked that it is not unreasonable for one nurse to have to care for 30 patients at a time. No wonder they're run off their feet and they're claiming mental health crisis of their own or burnout. We need to support those workers by getting more people. Now, one great thing, I don't want to totally focus on all the negative, because that's not who I am. One great thing that has come out of this is, with my family member being admitted to the hospital, this family member told me today during my visit that they are absolutely loving their nurse. Their nurse is one of the best nurses this person has ever had for their care. And this family member has been in the hospital before. In 2020, they'd been in ICU in a coma for 5 weeks, and the care they received then was unbelievably great. I have no complaints over their care, but I do have complaints when I see other patients that are not receiving the same level of care, because not all nurses or doctors have the same compassion. They may have gone into the field with that same drive, passion, and compassion, but they've been so overloaded, it's kind of drained out of them a bit. And of course, you're going to get the odd, not so great patient, and that's hard to deal with too. But now, the plus side of what our government is doing, there is a plus side. I'm not going to say that they're all negative nannies and that they don't do anything. That's not true. What they are doing is, like I said, they've started to address this crisis. One of the things that they've recently announced is that the local university here in Cape Breton is getting $59.2 million towards building or renovating a campus space in order to house a medical campus. That is so that they could start training in 2025, train and graduate 30 doctors a year. Part of the criteria for these doctors in training in this new local medical campus is that they stay in Nova Scotia, at least for a short time, and this new medical training facility, this new medical school, is also going to be able to accommodate up to 10,000 patients. That's pretty good. Not great, not 100%, but it's a good start. Another positive on that is this is only the second medical school in the whole province. One other thing that Nova Scotia has done recently is changed how medical doctors from other countries can operate in Nova Scotia. So specifically doctors from the US. If a doctor from the United States came to Nova Scotia, their criteria would carry over. So their credentials and all of that would carry over, their licensing, so that they can be a doctor in Nova Scotia. Not all provinces have that, but many are looking into it now. So that's great. We can get doctors more quickly that way. Some people have come here, have moved here from other countries, and their credentials did not carry over. And if they did, the requirement for further examinations was so extraordinary that they just said, frig it, let's just drive a taxi, or let's just work at a Walmart, or let's do something else. And they're skilled doctors that we're not utilizing. And I think that's tragic, because I'm sure that they're desperately great doctors. This is a shorter episode because I don't want to go on a full 30-minute rant. And I really am looking forward to positive changes in our healthcare system. If you have any questions about the Canadian healthcare system, I'd be more than happy to answer those questions. And if you have any comments, please list them in the comment section, and I will be happy to communicate and converse with you over it. Again, I'm not a healthcare professional. I only have opinions regarding our healthcare system. If you have opinions as well, again, I'd be happy to hear them. And this week, I was going to start my reaction to the new Big Brother Canada season that just started. But with all this healthcare stuff, I haven't watched any of the episodes. I'm fully behind already. I love Big Brother. So if you're into Big Brother Canada or Big Brother at all, you might want to follow me, subscribe to the YouTube channel, because I will be talking all things Big Brother. If not next week, it will be coming. And I promise you, I will dive deep on all the characters. I did see a spoiler that somebody left already. I'm really going to have to watch all of them, all the episodes, and really watch some of the behind-the-scenes stuff that is on the Global TV website. If you're in Canada and you want to follow along with me on Global, great. If you're in another country and can get a VPN network to Canada to see it, that would be wonderful. And if not, you just want to listen to the feedback here, you tune in, because I will be talking Big Brother. I'm going to start next week because I really love Big Brother. So until then, guys, take care, and we'll talk then. See you, friends.